Hi, Tofi. Good evening. How are you doing today? Are you fine? So, would you like to help us in today's session? And so, today we'll be discussing a dental anatomy. So, would you like to help us in any way possible? Oh, I see. Sure, definitely. Of course, you're more than welcome. Thank you. Thank you so much. So just now, Toffee informed us that she is going to help us in this discussion by giving us practical demonstration of her teeth as we discuss various morphological features of. Wait, Toffee, but we'll be discussing, we'll be discussing human teeth. In what way are your teeth going to help us learn subject? Oh, I see. Okay, so Toffee's point is any teeth is teeth as long as they're used for mastication. It seems you have a very valid point, Toffee. So we'll definitely consider your request and thank you so much for going to be able to demonstrate your teeth practically in life. So as we discuss various MCQs, I'm sure you'll show your morphological features of teeth. Is it okay? Are you hurt? Why? What did I tell you? I mean, what did I say? Why hurt? Why are you hurt, Toffee? Please don't get hurt. I'm just saying your teeth are in no way useful for us. We are studying human teeth, the morphological features of human dentition, not dog's dentition. You should understand that, Toffee. So we'll do one thing. You just take rest and we'll go ahead with our discussion. Is it fine? Okay. Thank you. Okay, so we had a brief chit chat and we decided not to allow her to exhibit her dentition as we're going to discuss human dental anatomy, right? So I hope everything is streaming fine. So please confirm the same. We'll go ahead with our discussion. Okay. Yeah, I think everything is streaming fine, right? Yeah. Is it audible? Okay. Yes, of course. Toffee is tremendous source of all the positivity in the universe. Thank you, Toffee. Thank you so much. No. You should never yawn. When we are in live session, yawning is a very bad sign. They'll call you a bad girl if you keep yawning. Never do that. I mean, try to close or try to cover your mouth when you're yawning. That would be a habit of a good girl. You're a good girl, right? You're a good girl. Okay, so today's live session will focus on few select topics from dental anatomy. And before that, we'll deal with yesterday's case-based question from general surgery. So before we start, so here is another lovely picture of one of the places in our country, Ooty. So lovely green landscapes, tea plantations all over. You can get plenty of chocolate. So tea and chocolate are the ones which we enjoy there when it comes to food. The climate is amazing and a must-visit place, especially in summers. In fact, this is one of the first places which we, myself and Swami, visited after a marriage. So a lovely place, and I would definitely recommend all of you to visit this place. Of course, after December 16th. So let's start with this case-based question. So a person comes with the complaint of a raised lesion on his chest, as shown in the picture, with severe itching on his. So he has been. He said or he mentioned about a history of surgery at this particular site. So could be some incision as a consequence of this wound healing, right? There could be some deviation. So injection of steroid has been found to be useful for this particular lesion. So treatment was done and they found out that injecting steroid has been useful in trying to address this particular lesion, as you can see. So what could be the condition? Keloid fistula sinus hypertrophic scar. In fact, I have altered the question. So yesterday was a different one. We added some new points and new inputs. So based on the available information, which one do you think could be more appropriate option? So we have two normal deviations from two deviations from normal wound healing process, which include keloid and hypertrophic scar. Each one is unique in its own way when it comes to anatomic location, various clinical features, predisposing factors, etc. So we'll deal with them now. In the meantime, you can try answering this question. So you can clearly see image, clinical image over the sternum area. You can see a raised lesion. So patient complains of severe itching, right? And also the anatomic location, those are the clues which you have. So we have hypertrophic scar and keloid, important differences between the same. Consider this table very, very important. So as the name suggests, there is hypertrophy of mature fibroblasts in hypertrophic scar. Blood vessels are minimal in this condition. However, in keloid, there is proliferation of immature fibroblasts with immature blood vessels. So immature blood vessels are also found in case of keloid. So these two conditions represent variations in normal process of wound healing. Keloid is especially common in blacks and least common in Caucasians. Keloid is not a true tumor, but has characteristic feature is marked tendency for recurrence even after excision. Keloid takes the shape of butterfly over the sternum. Sternum is the commonest site for a keloid, and it's extremely difficult to treat keloid over the sternum. However, there are some case reports suggesting that injection of steroid preparation, such as triamcinolone, into the lesion has been found to be extremely useful in some cases, at least. So consider these differences very, very important, and you can see keloid and hypertrophic scar respectively in this particular slide, right? So a person comes with a complaint of raised lesion on his chest, as shown in the picture, with severe itching. Itching, one of the important characteristic features. Again, even though itching can be present in hypertrophic scar, it's not as severe as mentioned in the table. So you can see the anatomic location, and we have a hint in the form of treatment. Injection of steroid has been found to be useful, so it's a clear-cut case of keloid. Okay, so well done. So good job. Now let's move on to today's discussion. We'll deal with some topics from dental anatomy, as I mentioned prior. So let's start our 20-second live quick revision class. So first question: teeth with major function to punch and cut food material, especially during the process of mastication. Maxillary molars, mandibular molars, mandibular premolars, option C, and option D, maxillary central incisors. So which one do you think is more appropriate answer? Yes, Ritu. Yesterday's question, the inputs were different. We altered those inputs and we have updated that case-based question. Yes, you're right. Yeah, yesterday we didn't mention about itching. Yesterday, depending upon the question we had yesterday, it was hypertrophic scar. I just altered it so that we could discuss a bit more about keloid. Good observation. With major function to punch and cut food, especially during mastication. So, molars, grinding, canines, tearing, so punching, cutting, it is incising action. So as you all rightly mentioned, excellent. Option D, maxillary central incisors, is right answer. So let's review some information regarding the same. The maxillary central incisor is large compared to lateral, as you guys are aware of, and these teeth supplement each other in function. That is, incisors supplement each other in function, and they are similar anatomically, even though the sizes vary. The incisors are shearing or cutting teeth. Their major function is to punch and cut food material during process of mastication. Option D is right answer, incisors. Very good. Keep it up. Now let's move on to the next question. Mandibular second premolar has more of characteristics of first premolar. Molar, canine, doesn't resemble any tooth. So what's your opinion regarding the morphological features of mandibular second premolar and its comparative analysis to that of adjacent teeth? So mandibular second premolar has more of characteristics of first premolar, molar, canine, or doesn't resemble any tooth. So which one do you think is more appropriate answer? Keep answering this. In the meantime, let's review some information. So mandibular second premolar, you can clearly see, especially in the left illustration, well-developed lingual cusps. So we're talking this in terms of occlusal morphology. Mandibular second premolar has more of characteristics of a small molar because its lingual cusps are well developed. a fact that places both marginal ridges high and produces a more efficient occlusion with antagonists of opposite jaw. So this is the context related to the occlusal morphology. Even though from the label aspect, it might be similar to that of first premolar, appears to be closer to that of first premolar as you mentioned. But the context here is we're talking about the occlusion. So mandibular second premolar, as mentioned in Wheeler's dental anatomy, I refer 9th edition, page 157. It has more of characteristics of small molar because its lingual cusps are well developed compared to that of first premolar. A fact that places both marginal ridges high and produces a more efficient occlusion with antagonists of opposite jaw. Mandibular second molar functions by being supplementary to first molar. So mandibular first molar is one of the important tooth or teeth for mastication, and second premolars and second molars seem to be complementing the occlusal functions, the grinding aspect, right? So even if you're wrong, you have nothing to worry about. So well done. So mandibular second premolar has more of a characteristics of a molar. Okay, right. I could have given you a context, but if at all, even though there is no context, occlusion is something which we give due importance to rather than the facial aspect. I hope you got my point, right? Very good. Now let's move on to the next question. Before going to this next question, I wanted to start with this. In fact, Toffee deviated us. So dental anatomy especially appears to be very easy subject, but it's a kind of subject where we can easily land in soups or traps. It's because most of the study which we do is theoretical. Instead, if we can have this image-based orientation, it makes a learning experience even more efficient and fun. So whenever you're going through, especially dealing with topics in dental anatomy, always try to have a clinical correlation, especially when you're dealing with the morphological features of teeth, the occlusal aspects, etc. Right? So consider this very, very important. So third question, which of the following features is typical of all mandibular molars? Flattened buccal cusps, flattened lingual cusps, flattened mesial ridge, flattened distal ridge. So which one do you think is more appropriate answer? So I'll show you an image. As I said, let's learn from images. Observe this, well-defined anatomy, especially related to posterior molars. Third molar is missing. So what seems to be a common or a feature that is obvious in all molars? So typical of all mandibular molars. So observe, we have prominent cusps. In fact, we have mesobuccal, especially in first molar, we have mesobuccal, distobuccal, distal, mesiolingual, distolingual. And then in case of mandibular second molar, you have two buccal and two lingual cusps. And when you compare the buccal cusp to that of lingual cusp, as you can see, especially on the right side, that is third quadrant, lingual cusps seem to be more prominent and sharp. However, the buccal cusps are relatively flat, not just in second molar, but also in first molar. It's all about observation, right? So observe this picture very keenly, and I'm sure it will be very obvious for you. So typical of all mandibular molars, flattened buccal cusps. So let's review some information. Wheeler's 9th edition, page 190. Mesiobuccal, distobuccal, and distal cusps are relatively flat. During carving, that would have been very obvious to you compared to that of lingual cusps. These cusp ridges show less curvature than those of any of the teeth described so far. The distal cusp, which is small, is more pointed than either of the buccal cusps. Flattened buccal cusps, I quote, based on the information given in Wheeler's and based on observation, which is obvious. Flattened buccal cusps are typical of all mandibular molars. Whereas lingual cusps, they're pointed, and there can be variations, but in general, for all molars, flattened buccal cusps seem to be typical. Consider this very, very important. If you're wrong, you have nothing to worry as long as you're learning from each and every MCQ, for that matter, each and every moment, right? Okay, so option A is right answer. I think some of you have chosen option A. Very good, keep it up. Yes. Now let's move on to the next question. The largest tooth in maxillary arch. Maxillary canine, maxillary first molar, maxillary second molar, maxillary third molar. So which one do you think is the largest tooth in maxillary arch? So you can see various occlusal aspect of maxillary teeth. So in this particular clinical image, it's obvious that maxillary first molar seems to be having large dimensions comparatively. So which one is the largest tooth? So answer must have been obvious to you. Maxillary first molar is normally the largest tooth in maxillary arch. It has 4 well-developed functioning cusps, including cusp of Caravelli and additional cusp or supplemental cusp of little practical use. So maxillary first molar seems to be the obvious answer, and of course it is. And what about the longest tooth in maxillary arch? So which one of the following do you think is the longest? I'm sure even that's obvious for you. Keep answering that. We'll move on to the next question. Yes, good, very good. Maxillary first molar in terms of dimensions and overall size, 3-dimensionally. Fifth question, an important portion of dental arch in the development of occlusion of permanent dentition is a tricky question. I'm sure with some thought you can answer it accurately. Central incisor area, molar area, laterals, premolars. An important portion of dental arch in development of occlusion of permanent dentition. So when we're stressing on permanent dentition, it means we're trying to compare that with that of deciduous dentition. So when compared to deciduous dentition in permanent dentition, which one or which portion do you think is considered to be important? Yeah, central incisor, molars, laterals, premolars. So which one do you think is a more appropriate answer? Yes, longest is canine, maxillary canine in case of maxillary arch. Very good. Yes, when you compare maxillary and mandibular canine, both are of same length, even though there is variation in length of crown and root by 1 mm, as you know. Yes, very good, Uttara. So, Inni, Kavita, Maurya, excellent. So, premolars. Why premolars? So, let me review some information because these premolars are replacing those of deciduous molars, where the mesodistal diameter of premolars is obviously less comparatively. So this alters occlusion to a greater extent. An important portion of dental arch in development of occlusion of permanent dentition is premolar segment. In this section, the erupting premolars are significantly smaller in mesodistal dimension than primary molars which they replace. The dynamics of this change in arch dimensions, particularly in mandibular arch, is important to a proper understanding of development of occlusion as well as malocclusion, right? So this is based on one's understanding. So as I said, as long as you're learning, as long as you consider every moment as an opportunity to learn, you have nothing to worry about. Okay? So well done everyone. Good job. Now let's move on to the final aspect of this presentation. Case-based question. A negligent cricket player comes to a clinic after getting hit in the face during the match with the ball, obviously. It's not a fist fight. So entire crown of the tooth has been knocked off and pulp chamber is open clinically. The incisal view of tooth shows triangular shaped pulp chamber. Which tooth got knocked out? I'm sorry for the spelling. It has to be no W over there, okay? So which tooth got knocked out? Maxillary central incisor, mandibular central incisor, maxillary lateral incisor, mandibular lateral incisor. So you have a hint in the form of the description of the clinical aspect of the incisor view of that tooth which was knocked out. That is triangular shaped pulp chamber. So try answering this. We'll discuss the same in tomorrow's quick revision class. Okay? I'm sure you're going to do it accurately. So do some homework and try to review the cross-sectional images or views of various permanent teeth, which we discussed in our e-classes elaborately as well. Okay? So which one do you think is more appropriate answer and why? And also you can come up with other cross-sectional images of other teeth as well. Okay, so these are some of the select topics which I wanted to highlight in this particular video. Yeah, I think it is streaming now. Okay, fantastic. So there seems to be some issue with Zoom. So anyway, so these are some of the topics which I wanted to discuss. So you need any further assistance or you need any further clarification, please, you're more than welcome to get back through mail 24/7. So exams are approaching and we're trying our level best from our side to provide you more inputs. And also we started using this YouTube Shorts platform where the length of the video is only 15 seconds. So we're trying to provide some key points through that particular platform. So I hope it will be helpful for you as well. You can spend some 1 to 2 hours every day to go through those topics. So today we have uploaded some 20 points in the form of 20 videos, YouTube Shorts, right? So wish you all the best, love you all, and keep giving your best. You have nothing to worry about as long as you believe in yourself. So sleep properly, eat healthy, and respect your biological clock. The rest of the day will be yours 100%. Okay? So I'll see you again tomorrow in another quick revision class. Toffee. So Toffee seems to be in deep sleep. Toffee. Toffee, you can say good night. Toffee, good night. Biscuit. It seems to be in very deep sleep. I don't know about you, but Toffee enjoyed this session by using this session to enhance her sleep capability. Okay. Okay, guys. Good night. Take care. Bye.